Hello there. I'm Dr. Isador Lieberman at the Texas Back Institute. I'm an orthopedic surgeon. Typically, individuals who are developing a scoliosis, particularly in the teenage years, will notice asymmetry of the shoulders, one shoulder higher than the other, or prominence of the hips. One hip is jutting out compared to the other. That's the first thing that most people notice with the scoliosis. In the adults, and scoliosis can develop on the basis of growth in the teenage years or on the basis of degenerative changes in the adult years. Those that develop the scoliosis in the adult years will first notice that they're leaning forward or leaning to one side. And in the adult years, it's more often than not accompanied by some kind of nerve irritation where they start to develop numbness, tingling, weakness in their legs. Early diagnosis is always better for whatever health issue there is out there. With respect to scoliosis, there are treatments that we can invoke to slow down the progression. We're never going to stop it. To reverse it means an operation. But there are other things that we can do to slow the progression and keep individuals functioning to the level they need to function. Typically, that's an exercise program. Sometimes that's bracing, and we do use medications to help control the symptoms. But you have to remember, what we're doing is treating the symptoms there. So early detection gives us the ability to control those symptoms and keep our patients functioning better. Undiagnosed scoliotic curves in the teenage, young adult age group can result in substantial disfiguring body shape and deformity. And from an aesthetic perspective, people don't like that. So that's why we want to detect early and treat early to minimize the progression of the curve. In the adult years, and I'm talking 55, 65, 75 year age group, undiagnosed scoliosis progression can lead to neurological symptoms where the patients are complaining of numbness, weakness, tingling in the legs, difficulty with mobility, and when it gets really bad, maybe even bladder or bowel issues where you have trouble controlling your bladder, have trouble with your bowel movements. So we don't want that to happen. So that's where we want to treat early, diagnose early, and avoid those longer term problems. As we all get older, the spine deteriorates, and to a certain extent we all develop an element of a spinal deformity, whether we're pitching forward or bending to the side. Bending to the side is the scoliosis, pitching forward is what we call the kyphosis. So if we're talking about prevalence, yeah, we do see a lot more of it in those over the age of 65, and we will continue to see more of it because we're all living longer. We've figured out how to live longer, how to control heart issues, kidney issues, lung issues, but unfortunately, the spine still wears out. The chassis of our bodies, the joints, still wear out. So we are going to see more of it in the older age groups. If you suspect that you have some kind of progressive spinal curve, either a scoliosis or a kyphosis, the first thing to do is see your primary care physician or get to one of our specialty clinics to be assessed. The assessment involves a physical examination, a history, and then an x-ray. The x-ray documents the way your spine is, the positioning of the spine, the extent of the alignment of the spine at that point in time. And that gives us a baseline to work from. Once you've got the baseline, the healthcare professional will tell you, this is what the problem is, this is what you need to do, these are the risks, these are the benefits. And first time individuals that notice a curved scoliosis, most of the time it's, let's get you fit, let's get you flexible, let's work on some stamina exercises. And oh yeah, if you're having a couple tough days with some back discomfort, an anti-inflammatory to control the symptoms is the most appropriate, least invasive way of addressing early deformity, early scoliosis issues.